The first tool we will be discussing is the audit. The audit is the primary tool used for alcohol screening in adults. And here is the pre-screening. Do you sometimes drink beer, wine, or other alcoholic beverages? We talked in the earlier session about the pre-screening. So in this one, this is quick, effective, and thorough. The process, and through this process, the first decision is made and in the pre-screening. If the answer is yes, the NIAAA single question screening question is asked: how many times in the past year have you, if you're a man, so had 5 or more drinks in a single setting, or if you're a woman, 4 drinks or more? Now, in this case, this has to do with being a biological man or woman, as it is our biology that impacts the way alcohol has an impact on us physically. If the answer is 1 or more, a complete alcohol screening using the audit is completed. If the answer is no, you're finished screening for alcohol. Alternatively, you might use the audit C, a 3-question pre-screen, and based on the findings, complete the full audit if necessary. Other questions might be asked and to determine the average drinking limits in a day and in a week. The weekly drinking limits were established as a result of an NIAAA study that assessed long-term health consequences of alcohol use. Persons who consumed at a rate higher than these drinking limits were at long-term risk for health consequences. So these are the questions that are asked, and again, you can see it's divided by men and women. And if it's more than the regular limits, this is considered at-risk drinking. The at-risk drinker can be defined in 2 ways: drinking in excess of drinking limits or binge drinking episodes. With youth, we often see more binge drinking. Considerable research has been generated from these foundational NIAAA studies, much of which has confirmed that exceeding these guidelines can significantly increase risk for alcohol-related problems. The National Institute of Alcohol Abuse and Alcoholism 9th Special Report to the U.S. Congress on Alcohol and Health from the Secretary of Health and Human Services and others have routinely supported these guidelines and the benefits of screening in this way and the risks of alcohol, even at levels that many would consider lower in use due to our cultural acceptance of alcohol. Studies demonstrate that 5 or more and 4 more limits accurately reflect the amount of alcohol consumed at which psychomotor and cognitive impairment is notably increased in both men and women. Epidemiological risk curve analysis reveals significant and rapid increases in the risks of unintentional injuries, deaths resulting from external causes, being a target of aggression or taking part in aggression-related events, an alcohol use disorder, or an unfavorable medical, work-related, legal, or social consequence related to drinking. As the frequency exceeds their guidelines and as that frequency increases, the likelihood of developing any of these problems increases. They conducted extensive nationally represented epidemiological surveys that included questions regarding the frequency with which people drank more than 5 drinks in a given day. Findings indicated that exceeding these drinking limits can significantly increase alcohol-related health problems. The audit is a public domain tool created by the World Health Organization. You can download a copy from the World Health Organization website. Audit is simple, straightforward, can be administered in many ways, can be self-scored by the person and administered by a worker. It can also be embedded into a tablet or electronic health record if you were in a healthcare setting. It has many strengths as a preventive and early intervention tool. It's available publicly, which is very nice, validated over decades of use, translated into numerous languages, and it grades risk from low level to a high level. It's presumed at the high level to be dependent use. The limitation is that it only screens for alcohol. Otherwise, it's just a fantastic questionnaire. And here is the complete questions on it. You can see there's these 10 questions, and they're given a point based on the answer, and then those points are added up, and this then determines what level of use the person has. So, and here's the relationship between the domains and the question numbers themselves with the content, if you're interested in how those instruments are developed. So in scoring it, if you score here a 0 to 7, you're considered low risk. Dependent use is 20 and above, and then 8 to 15 at risk, 16 to 19 harmful. And you can see most people you score will be at low risk. However, and what we want to do with people who are at low risk or no risk is to reinforce the health benefits and emotional benefits and societal benefits to their safe or no use of alcohol. So that's mostly what you'll find yourself doing. Those persons at harmful levels of use and who are at upper reaches of risk represent the target population for SBIRT. And for those, there'll be a brief motivational interviewing. And that conversation has shown to have great benefit in helping people decrease their use. Many people are not aware that their use is at risk, harmful. And that is really the benefit and the point at which negotiated referrals to treatment are also an important goal in that dependent harmful use, depending on the person's individual circumstances. An audit score of 8 or higher for young adults over 18 years of age includes and indicates an at-risk, harmful, or hazardous drinking. Scores suggest that low risk are 0 to 7, moderate or potential harms 8 to 19, high risk. But we need to remember that for anyone under the age of 18, any use is considered high risk. And a score of 10 is not necessarily better than an 11, as both scores fall within the moderate risk range. So remember that you don't really want to split hairs with this. This is basically throwing people into a large basket. It's not, and the individual audit score is not as important as determining the level of risk. So don't focus in on the number that's included, focus more on the category that the risk determined, because that's how the tool was validated. You're encouraged to use your own clinical judgment to evaluate whether someone needs further assessment, especially when the audit score is at the cusp between different thresholds. So that is what we have for you for the audit, and we will next go on to discuss the DAST.